All right, we'll go ahead and get started. Thank you all so much for joining us for our second Community Climate Forum. My name is Lisa Ligis, and I will be your host and moderator tonight. I am a Conservation Education Liaison at the Zoo and co-chair of the Zoo's Climate Change Task Force. Before I introduce our presenter, I want to give a quick overview of how this webinar will work. First of all, this webinar is being recorded and it will be shared at stlzoo.org/climate change. The same page probably where many of you registered for the webinar. Because this is a webinar, we are unable to see or hear you, but our goal tonight is to engage with you, hear your thoughts, and answer your questions. A few of my colleagues will be assisting me in monitoring the Q&A and the chat, but please put your questions in the Q&A and any thoughts or discussion points you might have in the chat. Please remember to be respectful and courteous to our presenter, panelists, and each other. And please keep your questions and thoughts relevant to the topic. If someone is unable to follow these protocols, their comment or question will be removed and they themselves may be removed entirely from the webinar. Our presenter will also leave us as much time as possible at the end of her presentation to address questions and discussion points. Now, without further ado, let's get started. Our distinguished presenter tonight is Dr. Sharon Deem. Dr. Deem is a wildlife veterinarian and epidemiologist and the director of the St. Louis Zoo Institute for Conservation Medicine. Take it away, Sharon.
Great, thank you, Lisa. And it looks like thumbs up, you can hear me and see me. Really appreciate being able to spend some time with everyone tonight. So thank you for this opportunity. We're going to be exploring One Health and looking at this as a solution-based approach for combating climate change. So if we do this right, I'm going to start us off hopefully with about 25-30 minutes of slides and a presentation, and then we'll get into that discussion period Lisa mentioned. What I'd like to do is introduce you, if it's new, particularly to the initiative, the approach, the movement of One Health. Think about some of the challenges facing the health of all life on Earth today, focusing in on climate change, some of those other challenges, and then, how do we create the future we want to create? So looking at those solutions and not just thinking about the challenges themselves. So what is One Health? And hopefully many of you have heard this term before. It is a growing movement, I would say, and the St. Louis Zoo is a leader in this field. It just came into the vocabulary back in 2007, an article that was published in the scientific peer-reviewed journal Science said that the easy definition is One Health is this initiative that aims to merge animal and human health to benefit both human and non-human animals. So this was just not quite 15 years ago where this concept and approach of One Health first really got some attraction and attention. There have been a number of definitions since that time of what One Health is. I particularly appreciate this one from the One Health Commission. One Health is a collaborative, transdisciplinary approach working from the local to the global to achieve optimal health and well-being outcomes by recognizing the interconnections that people, animals, plants, and our shared environments have. So how the health of each of these parts of the One Health triad impacts the other and is influenced by the other. So really this understanding that all health is connected and that we need transdisciplinary approaches to really come up with solutions to the health challenges we face today. So that was 2 slides defining One Health for you. I'm currently teaching a One Health semester course at Washington University in St. Louis. So as you might imagine, there's much more to it, but hopefully just those quick little definitions of thinking about One Health will help us as we go into exploring climate change. But I also, some of you may be thinking, well, I've heard the term zoobiquity. You're from the Institute for Conservation Medicine, the St. Louis Zoo's Institute for Conservation Medicine. There are many terms out there for what I consider very much the same concept, our appreciation and understanding of how connected the health of all life is on planet Earth. We even in the last 5 years or so, planetary health has come up as a means, a term for this movement. So what we're going to do tonight is go ahead and trump all of them and just call it intergalactic health, which is really just appreciating whether we call it one medicine, zoobiquity, one health. We really do understand how connected the health of all life is and how we influence the life forms of others. So why are we going to talk about One Health in a climate forum? So first of all, when we think of the health challenges of today and why One Health came into creation, why we have courses in One Health, why we have majors and PhDs in One Health, for me, it really comes down to the appreciation of the period of time we are now experiencing on Earth. And this has actually been coined the Anthropocene. So the geologic epoch we're in right now is the Anthropocene. So anthro for humans, and we humans are the drivers of the changes of Earth today. So if you look on the right here, the Earth system trends and sort of the report cards of some of the various measures we take on the planet, we can see in almost all cases, the report card is going in the wrong way. So like CO2 emissions. So the human driving forces that are really leading to some of our truly planetary health problems is, in my mind, the reason that One Health and this movement has really taken traction. We need transdisciplinary teams to come up with solutions to these One Health challenges. So what are the greatest threats to our shared One Health, right? And here's a list of sort of the usual suspects, as we say, and the threats that hopefully many of us are thinking about today. And climate change is on the top, emerging infectious diseases, right? We're in our Zoom box right now, going into year 2 of a pandemic. Food security, wealth inequality, science denialism. So all these sort of threats that really are part of the Anthropocene and part of why One Health has become a movement to solve some of these challenges. And I think when I go over these next few slides, it's really important to think about how climate change, that incredibly important threat to the health of life on the planet, is tied in with these other threats. And hopefully that will become apparent as we go through a few slides. So, I like to say we are in a hot mess, right? And this word cloud is from a TEDx talk we did a few years ago. And you can see climate change as one of the real conservation public health challenges that has led to having the One Health movement, along with the others. So I'm just going to do a few slides to touch upon those sort of big points, right? So when we think about climate change, there's many aspects of it, but we can just look at 2021, right? And the major wildfires around the globe and the human drivers that are leading to climate change wildfires. We also know that today we are living in what many call the 6th mass extinction. So we are losing biodiversity, or just species, the diversity of life on our planet. We are losing them at a rate not seen since the time of the dinosaurs. And we have in the Anthropocene helped to wipe out 68% of animal populations. So really the decrease in animal numbers, let's say African elephants, the loss of species, many frog species that have gone extinct, And again, that sort of laundry list of the challenges, and you can see climate change at the top there of why we are having impacts on biodiversity. And then lastly, emerging infectious diseases. And we know today that 75% of the emerging infectious diseases in our species are related with animal reservoirs. They're what we call zoonotic. So non-human animals and humans share these pathogens, and they often spill over from wild animal host, right? So we can think about those kind of big challenges today: climate change, emerging infectious diseases, the loss of biodiversity, and how they all kind of feed in and play off each other. And I really think it's important to consider COVID-19 before we really focus in more on climate issues. But, you know, here we are moving into year 2 of this global pandemic, where nearly 5 million humans have lost their lives, where we know today what it's meant from a human welfare, a human livelihood, the impact on our species in general, the economics of it, but also just the instability, the planetary instability. This too is related to climate change. There's discussion now about the movement of bats and changes in climate driving changes in bat movements, food security questions, and the animal products that we may be eating. So we can see even where this pandemic may very well be tied into climate change questions that we're facing. And then lastly, before we're gonna hop it right into climate change itself, I think we also need to be thinking about this question of misinformation, maybe science denialism, some of those challenges to public health and conservation today, and One Health. And I just listed a few questions here that I hear often. And, you know, do you believe the climate is changing? Do you believe in climate change? Kind of the same question, a little bit different. Do you believe humans play a role in climate change? This Anthropocene concept. Do you believe that humans can do anything about the climate changing, whether we are in agreement that humans are involved or not? And I find this really interesting when we think about sort of the dynamics of climate change today. And a good friend of mine actually said to me, you know, Sharon, I'm not a scientist. How do I know? How do I know about climate change? And I think that is something that's very interesting to think about. I often think, well, you know, you go to a human doctor and you're not a human doctor, but that's why you have a human doctor that's helping you with your health outcomes. And so we do have scientists, right? And we have many scientists who have been looking at the climate change question. And as I'm sure many of us on the webinar have seen, the recent 2021 IPCC report, Code Red for Humanity, right? So the science is there, the data are there that are showing that report card I presented a few slides ago, and some of the climate change indicators of how the climate is changing. So example, and this report is, I think, 3,927 pages, so I don't expect any of us to read all of it, but there's many graphs in there, such as this one, where if you look on the right, the observed human and natural, the change in climate that we're seeing over a short period of time, right? So the data are there, the climate is changing. So what does that mean from a One Health lens, right? So we can think from the individual up to populations, up to ecosystems. So from a One Health perspective in the individual, we can think of the dog in a hot car. We could think of our own individual health. And we know that these hyperthermic or climate warming changes that actually happen at the individual level. We also know that by the year 2100, so 80 years from now, 74% of the world human population will be experiencing deadly heat waves. And what that means for the individual health of humans, domestic animals, wildlife, plants, and so forth, the individuals. We also know that climate change global health impacts have all these other sort of cultural and social impacts on the functioning of society today. So, for example, we have a few listed here: the loss of habitable land, right? The loss of land, arable land that we can raise agriculture, food security, climate-related violence and climate refugees, extreme weather events. Many of us are very familiar with that in the last few years. The loss of biodiversity, the movement and spread of infectious diseases. So again, with your One Health lens on, you can see where climate change is really involved in all these kind of shared health challenges that we're facing today. And then lastly, I'll use Australia as an example, but this is just one example when we think from the conservation side, which we at the zoo are very much involved in, thinking about the biodiversity conservation side. In early 2020, this was just a month or two before the pandemic, before we were aware of the pandemic, the wildfires in Australia, we know billions of animals died and lost their life. So that sort of population ecosystem level impacts of climate change. So again, we did a talk just when the pandemic started, and one of the sort of metaphors we used is this idea of the planetary heart attack, right? So we are in this period which thankfully we are really starting to appreciate the crises and challenges that face us today, and climate change is one of those. And I know many of us on this call, and hopefully Carrie and Lisa are going to talk a bit during the discussion, have spent a lot of time thinking about climate change in the past years, but now the world is really thinking about it. There's movement, there is development, there's One Health transdisciplinary teams coming together to say, how do we solve some of these health challenges that are linked with climate change? So this talk is very much focused on solutions. And as we say in our course at WashU, One Health was born out of crises, the Anthropocene and some of those health challenges, but it's about solutions. It's about having teams come together to combat these challenges, and one of them being climate change. So the last few slides, I'd like to just go through a few thoughts about solutions, about how One Health helps us with that, and hopefully that will help move us into the Q&A and discussion period. So the other thing I like to think about, right? So hopefully we all have a future. We have a tomorrow, we have a next year, we have a next century. And I love it. Abraham Lincoln is credited with this. I'm sure more than just Abe said this, but the best way to predict the future is to create it. And I think that's a very One Health kind of statement of how we are the ones who will decide what the future is based on the actions we take today. So where does One Health fit into this? I've gone through the challenges and how climate change is kind of connected to some of those other conservation and public health challenges, which is from a One Health lens. But where does this fit in with climate change? So one of the things about One Health, this transdisciplinary idea, it is not just healthcare professionals, right? We need the politicians and the economists, the religious leaders, storytellers. We need these various disciplines coming together to look at climate change, right? And to figure out what are those mechanisms we need to put in place to mitigate, to minimize some of the impacts of a changing climate. And that's what One Health is about, bringing these teams together, these disciplines. The other thing that I think is really important when we think of those disciplines and we think of One Health is sort of those points along any One Health challenge and where those disciplines come in. And I do realize this graphic I'm using is actually from an article we at the zoo published last year on COVID. So if you look on the left there, you have pathogen to human zoonotic pandemic, and some of those different nodes of where things can be transmitted when we're talking about a pathogen. But I think we could change these, change the words on this and have it be climate change. And think about it from those individual actions up to sort of planetary climate change and those different points along that gradient and the disciplines and the ideas that are needed to actually come up with solutions across that sort of from individual to planetary. And hopefully what I just said will generate some questions and discussion here in a few minutes. But the other thing that I think is really important when we think about One Health and in the context of climate change, and one of the discussions my students remind us of a lot is sort of this idea of corporations and individuals and our responsibilities, right? So what can I do as an individual? You know, it's all about the corporations, or, you know, if we don't change policy, nothing's going to work. So I think it's important to remember that corporations and the way the world is set up today is set up by humans, right? So it is people that make those differences, that make the differences and can move things forward. And this statement, when I was putting this talk together earlier this week, I really thought was a good reminder of where each of us fits in, right? So when an individual changes, society will change. When society changes, the whole world will change. And I think if we put in here, you know, the welfare, the health of an individual is bound to the health of the society, the health of the planet. And I very much, when we think about climate change and those individual actions up to the corporate actions, the societal actions, up to the planetary impacts of climate change and how our actions will decide on the future with mitigating or minimizing some of those impacts. So, you know, we get to create the future, right? And I really appreciate that the One Health approach, bringing disciplines together to tackle a crisis such as climate change. We have all these different tools and actions that we can take, right? And I just want to sort of look at that last one there, because I know many of us are dealing with COVID fatigue today, right? And sort of here we are, year 2 in a pandemic. Here we are hearing about climate change and challenges. But I really think, I know actually, and I see it with the younger generation, with a lot of people right now turning that sort of fatigue into action and really, you know, understanding where we are today, having the tools, using a One Health approach and what that can mean to really tackle these challenges and have those solutions that will help us to create the future we want to see. And lastly, my last slide, I like to think about both these women, and I didn't have to put Greta and Jane up there. I bet the majority of us knew who these two were before I put it up here. And I think, especially if there's younger people listening, people starting their career and thinking about things, or 11-year-olds, teenagers, whatnot, you know, Greta, 5 years ago, I wouldn't have Greta in this talk, right? She was a young woman who decided to think about things, take a stand, and she has made change. And I think, and Jane on the other side, who is an older woman and had her whole career thinking about chimpanzees and conservation and really has become an ambassador for planetary health. We can see, hopefully we can all see a role and these two women as models of where our voice and our actions really do count. So I'm going to end with that. I would just like to say I really appreciate, hopefully you can see, I like talking about One Health. I like thinking about the connections of the health of all life on Earth. If you're not familiar with our department at the zoo, please visit the website. This book I put up here is the one we use to teach the course. It's very story friendly. It's very user friendly about the challenges of One Health, but also the solutions. So I'm going to stop there. I'm going to stop sharing my screen, I think, and then we'll open it up for Q&A and discussion. Thank you.
Thank you so much, Sharon. It's neat to see. Well, it's always nice to see the connections between One Health and climate change, because they're, like you said, there's just so, I mean, it's all about connection, right? And I also leads me to think about like the sustainability, sustainable development goals, and just all these different ways we look at life on Earth, how it's connected, and then how all those connections can lead to better things and solutions and ways to move forward. While we're waiting, I invite anybody who would like to have any questions answered or any topic related to this, or something you've read or discussed before that you would like us to bring forth, go ahead and put it in the chat or the Q&A. And while folks are thinking on that, I do have one kind of just almost like an observation. I am in my upper 30s now. And when I was younger, the solutions we were taught were very individual based. So reduce, reuse, recycle. And, you know, what can you do even as a child and as you're growing up, what can you specifically do? And now when I look at like your students and kids that are this upcoming generation who are really looking at it from a totally different lens of, yeah, I do that. So what's next? You know, who can I reach next? How can I advocate? How can I make my choices, my voice have an even bigger impact? And I was just kind of curious, you know, what kind of amazing things are coming out from your students.
So it's interesting, and that's sort of when I put this talk together, and that's why I wanted to mention the corporation versus the individual actions, and does my individual action help? And we've had a lot of discussion this year, and this is our 4th year of teaching this course, and I'd say more than any past year about that very topic. And, you know, if we can make some kind of great discovery where even gas or fossil fuel generated cars are emitting, you know, 1/10 of what they are today, I mean, that's a game changer, right? So those kind of technological changes, if we get those in place, and corporations are on board, that's going to be more than me turning off this light the minute we're done, right? But that said, and I think the students, this younger generation, they see what's happening on the planet, and they are energized. Those individual actions, I think I started this talk with that, you know, small acts by a lot of people equals, you know, great things, you know. So individual Greta's, like she was a little girl in Sweden, right? And they do add up. But also those breakthrough, you know, those kids in the class right now, they might be the engineer that comes up with that great thing. So they both have to be working together. And I have to say, from a really positive, optimistic point, this is the first time these last few years, the pandemic, climate change, where it's being talked about at, you know, the G20, it's being talked about on a global stage by leaders around the globe. And that's really positive.
Yeah, definitely.
Dr. Deem, we have a really good question in the chat. And I believe that you will have a lot to say on this. The question is, what percentage of scientists do not believe in human-caused climate change? That is, scientists who refute the majority's logic. And how can we effectively persuade friends who follow that minority of scientists supported by large media outlets? I ask because we have a conservative friend who says you are simply listening to the wrong scientists. Please help. That is a great question, Annette.
That is a great question. And I'll start it off, but if others on the panel would like to answer it, please do. So I'll start by saying I don't have the exact figure. I was going to say earlier when I had that slide up about, do you believe in climate change kind of thing? I was going to say, if you get 100 scientists together, 99.9 of them are going to say climate change is real and humans are the drivers of it. And that 0.1% might be on some of those media outlets with a loud megaphone, right? That is possible. But I to be honest, I don't have the exact figure. Somebody can Google it quickly and get it for us. But it is tiny and small, right? And so, but I think the second part of that is something, again, we discussed in our One Health course, that that amplification of a minority of science denial coming from the mouth of a scientist gets a lot of traction. And like my friend who says, look, Sharon, I'm not a scientist, how do I know? And then listening maybe to the wrong general misinformation, that's hard, right? And I think that's part of that challenge that with One Health and bringing those communicators together, those sociologists, those theologians and cultural icons to really help get the right information out, help the scientist get the right information out is so important. But Carrie or Lisa, if you have other thoughts there, please chime in.
Well, when
go
you,
ahead.
oh, sorry, Carrie. It just, when you were mentioning, and in your slides too, Sharon, about how so many people from all walks of life, it's going to take that to come together to really make the really big changes. And that's goes hand in hand with the first webinar when Hannah was sharing all the different ways that resonate the most in terms of communication, how we can communicate climate change to move the needle, to move people towards solutions. And it's reaching people wherever they're at. So you can reach somebody that, is a pastor at a church, the same, a very similar way you can reach somebody that's a high level CEO and, basing it on values and, really understanding people and what motivates people. So that just, resonates with me whenever we think about how we can come together, no matter who we are, to find that common ground to move things forward. And Carrie, I'm sorry, go ahead.
Oh, I was, and that is a fantastic point, Lisa. And kind of going off of that, I am also able to attend the One Health course that Dr. Deem is teaching. And we actually just had a class where we talked about communication. And I think when you are talking to someone that may have very different views, if there's any way to tweeze apart the emotional aspect of the conversation and go to the science aspect, it may be a way to move the needle. I do know that we were talking about that in class, that the best way to engage people and really get to them is to look at their values and their core emotions. And if argument is being posed that is more on the emotional end and not the science end, if there's any way to work around that to get to the science part, there may be a way to sort of peel that onion back and see the logic behind what is being said and maybe find that common ground in the science end of things. But yes, it is a very complicated and emotional conversation. There in the chat, we had a comment, and I need to get back to the chat. Dr. Deem, there is a person in the chat. Her name is Grace. She is a junior in high school and therefore is unable to vote and does not have money to do certain things. She wants to make a change. Right now, just doing the light bulbs and reusable appliances, spreading awareness. They want to do bigger actions, but don't have that influence yet with money and voting. What would you suggest as something to do a bigger step?
So, Grace, I'm so glad you're here, first of all. And this is one of those big steps, right? Just interacting and talking with other folks that are thinking about some of the health challenges that are facing all of us, but your generation. You will be able to vote soon. Trust me. It comes sooner than you think sometimes. So that's good. But really, all those individual actions do add up, right? And so if you have the ability to walk or bike versus drive, if you have the ability, well, here's one idea. And again, we do this in our college class, but you could do it at your high school or middle school. And there's an actual footprint calculator, right? So you could do it with your family, and you can look at sort of your carbon footprint, right? And it talks about how you warm your house or cool it, or whether you fly 10 times a year, and the food you eat, and all these sort of individual things that do add up. And it's kind of a fun exercise, actually. If you do it in a group, if you're taking an environmental science class at high school, you could do it with that. And so those are the kind of things that I think really for those young people who still might not see what is happening or what they can do, you could help to advance their understanding. I think you said, I can't see the chat, unfortunately, but advocacy. I mean, using your voice, talking to your friends, talking to your parents and older people is great too. I think there's more older people interested and involved than maybe some of the younger generation realizes. I mean, look at us here in our little buggies. I mean, Lisa is at least in her late 30s, right? Say that. So I think what you're doing is great. There are actions, there are steps that you are taking and can take. And then when you're ready to vote, when you're ready to spend more money, hopefully not buying a lot of things, you can then use that as well.
And Grace, one thing that came to mind as well, knowing you are in high school, we have a lot of teen volunteers at the zoo. And one of the things a lot of them have been able to do at their schools is find other like-minded students and organize. So they've created green clubs at their school, green organizations at their school. And that gives you a voice at your school to do green challenges, there's all kinds of stuff, ways that you can turn your school more green, turn the students more green. And that way it's more collective. It's a group thing rather than just individuals. So I can't think of everything off the top of my head, but I know there's a plethora of resources out there. If you search green schools or green school challenges, that you can find a lot of information on ways to do it as a school or even as a class. Anything that makes it more of a group project, something others can join, will help create more action and bigger impacts. Okay, we did have another question in the Q&A this time. And
Lisa, the one in the chat as well, they sort of go together.
Oh, you know what they do? Okay, we'll do that one next and then we'll shoot back to the Q&A. Good call, Carrie. Okay, the next question from Emily is, how do you think we should work with corporations whose bottom line is to make money by getting us to buy more of their stuff? If they do what's best for the climate, they will not exist anymore. So basically, if they change their bottom line, it will not, So won't we be on opposite sides? So where do we stand when it comes to corporations and them not wanting to change what they do, because then it could put them, out of business?
So Emily, I love this question. This could be a semester-long course in an economics department. So just a few thoughts, because I think it's an incredibly important question, and it might be one that we all it's not like this or that. There might be a threshold for many people, but the things that kind of came to my mind is money makes the world go round, right? And most businesses are for profit. So that is reality. That is how our systems are built up. I love Patagonia as an example. Understand it's high-end equipment for outdoorsy kind of people, but the founder of Patagonia is credited with the statement, there's no business on a dead planet, right? So there's no business on a dead planet. And I do appreciate more business models that are putting that into their calculations. So they, you don't have to have a CEO that makes $500 million, not calling out any particular corporations, but, like, why bother if you're going to have a dead planet? And I do, again, I from a positive aspect, those conversations are being had. So you can be for profit. You can make sure people have homes and food and things that make for a nice livelihood, but not do it at sort of a high-end greed level. And I know, Lisa, you're dying to chime in here, but the other part that I think is really interesting when we think about corporations and making money versus helping with planetary health, it doesn't have to be an even or. There's a lot of corporations and companies now that are developing, whether it's green energies or food items that are more planetary friendly, that do make money. So that's kind of a niche with corporation development of making money and having your employees and your people who invest in you making money, but you're advancing planetary health. And I think that's a hugely growing field that we'll just see blossom in the coming decades.
Yeah, the only thing that I also think of is when companies, again, can't call any companies out specifically, but when a lot of companies realize that doing it a greener way can actually save them money, have higher output, things like that, then it's a win-win. It doesn't have to be mutually exclusive. And like Sharon said, the next person to come up with these innovative ideas, is probably in a classroom somewhere right now. That's going to help, solve these things and, be able to move these things forward. So yeah, that's a great question. And we actually had another one kind of similar, but it focuses a little more on your actual purchase power. So the question is, how, as consumers in a middle class or lower tax bracket with that type of corresponding purchasing power, have the voice and be able to encourage companies and corporations to offer their sustainable goods and accessibility throughout? Yeah.
So I love this question too. I'm not 100% sure I'm going to answer it with the question that was in mind, because I think it's a really nuanced and important question. So we all buy something. Hopefully all of us will eat today, right? So there are certain things that even on the smallest budget, we hope to do. And we can decide whose company or whose purse we're going to put that dollar into. So I think that's a power we do all have at whatever level, from your level, that person's level, up to Jeff Bezos. We have our dollar. We can do what we want with it. I think where it gets more challenging, and what I'm not quite sure of the question, but it might go in with Emily's earlier question, is that sort of, there are companies that we can't even purchase in because it's outside of our range. I think that might be the question. And that is a harder and incredibly important sort of those wealth and income inequality and social determinants of whether it's climate change or other One Health crises that would be really hard to answer in a couple of minutes right now, but are things that, again, in the One Health framework are thought about and discussed a lot. So I guess I would just end by saying your dollar, no matter what it is, it does have power. There are structural changes that have to happen as well at a different level, at the corporate level.
Yeah, and also thinking about solutions and how, where places, a lot of lower income places also have, are also food deserts and have a lot of food insecurity, and a lot of solutions for that also end up being green solutions, like more community gardens and more accessibility to fresh foods through growing them and creating spaces for that. So that in itself, and growing more native plants and native food, all of that creates, is in and of itself a green solution, and also can help people, like you said, they choose where your dollar goes and choose where your resources go, and work to solve multiple issues and multiple things that people are dealing with.
That's an excellent example. That really is, from the food deserts to the community gardens, which here in St. Louis are popping up, as well as other places here in the US and elsewhere. But that's a really excellent example. Yeah.
I would also mention that letter writing campaigns to companies does make a difference. A lot of times companies are unaware of issues. I think by now a lot of companies are aware of palm oil, but just 5 years ago, talking to local companies and asking if their products use sustainable or unsustainable palm oil, we had a significant shift in some big companies in St. Louis that were unaware of that issue and then researched it and shifted. So I would not underestimate the power of letter writing and talking to companies.
Definitely. Okay, I am looking in the chat and the Q&A. I don't see any other ones that we've missed. But if anybody has any last ones before we sign off, type as fast as you can. And Carrie and Kathy, did you have any other points that you think would be great to bring up?
No, it was a wonderful presentation, and thank you so much for hosting.
No, it's my absolute pleasure. Anytime I can be in a room, even if it's a virtual room with you guys, is an absolute joy. Okay, well, all I'm getting is thumbs up and great job. So I think we are good to go. Again, I want to thank you all so much for joining us tonight. Just remember, this is being recorded, so it will be shared again on the zoo's website at stlzoo.org/climate change. Thank you again so much, Dr. Deem, and Carrie and Kathy, for joining us tonight, and all of you, and everyone have a great rest of your evening. Thank you all so much.
Thank you.